Okay, so we're going to talk about anesthesia and developing brains implication of the FDA warnings. The long-term adverse neurodevelopmental effects that have been observed after prolonged or repeated anesthesia administration are difficult to interpret because of confounded by indication. Otherwise, healthy young children do not undergo lengthy longer than 3 hours or repeated procedures under general anesthesia, and the brains of children born prematurely or with cyanotic congenital heart disease may have been injured by inflammation or chronic hypoxia. So here's a video about a kid talking about anesthesia in the Johns Hopkins Hospital. I'm not going to play it. So here are some trial results. Most recently, the interim analysis of the general anesthesia versus spinal anesthesia study in the pediatric anesthesia and neurodevelopment assessment study, both of which involved formal neurodevelopmental testing, revealed that a brief single exposure to general anesthesia was not associated with poorer neurodevelopmental outcomes. About the drug safety communication, the FDA issued a drug safety communication warning that general anesthesia and sedation drugs used in children less than 3 years of age or in pregnant women in their third trimester who were undergoing anesthesia for more than 3 hours or repeated use of anesthetics may affect the development of children's brains. So, the new warnings of the FDA will result in a labeling change for 11 common general anesthetics and sedative agents that bind the GABA and the NMDA receptors, including all anesthetic gases such as sevoflurane and intravenous agents as propofol, ketamine, barbiturates, and benzodiazepines. Here's a video about what does anesthesia do to your brain. I'm not going to play it. And here's another video about the FDA warnings. It's about a doctor, a pediatric doctor of the Mayo Clinic talking about it. Now, application medicines, the warning will raise concerns and questions among practitioners, pregnant women, and parents of young children. Questions for which there are currently no clear answers. It will also change medical practice for many of the estimated 1.5 million to 2 million children under 3 years of age who undergo anesthesia annually in the United States. The pros and cons of general anesthesia: the pros are immobility, pain control, airway protection, and the cons are hemodynamic changes, additional workforce, and time delay. So the issue applied in Ecuador until reassuring that new information from well-designed clinical trials is available. We are concerned that the FDA warning will cause delays for necessary surgical and diagnostic procedures that require anesthesia, resulting in adverse outcomes for patients. And the conclusions are that essentially all prolonged procedures lasting more than 3 hours are not serious of life-threatening congenital conditions for which there are no alternative treatments and for which treatment cannot be delayed until the patient reaches 3 years of age. In this scenario, the benefit beats the risk, so general anesthesia is 100% indicated.